Live from the KGO TV Broadcast Center, this is ABC 7 News.
Well, a San Jose man says he is worried about the number of CT scans his doctors have ordered.
Yeah, and ABC 7 News I-Team reporter Dan Noyes is here with an investigation into the risks and the benefits of this.
Well, Dan and Carolyn, the patient we talked to, has already had 17 CT scans.
I'm the patient, and I go there for help, and I go there for to get well. I don't go there to get more problems.
Up next, Brian Cross has one more problem. We'll show you the letter his doctor sent him and what it means for his medical care.
Risk versus reward is the debate in the medical community over a common test frequently ordered by doctors.
That's right. One local patient came to the I-Team worried that he'd been exposed to too much radiation.
ABC 7 News I-Team reporter Dan Noyes is here with his latest investigation.
Carolyn and Dan, the use of CT scans has increased more than 20 times since 1980. They are used in every hospital every day. The doctors we spoke with say they are overused.
I believe I've been exposed to too much radiation.
44-year-old Brian Cross of San Jose was diagnosed with colon cancer in 2009. He had surgery to remove it, but not before the cancer spread to his liver. In the course of his treatment, he says he's received 17 computed tomography or CT scans. That's about 4 per year. Depending on the type of CT scan, the radiation dose can be 100 to 500 times more than an X-ray.
I used to joke around and say that I would glow in the dark.
Cross is concerned that each of the 17 times he was exposed to radiation makes it more likely he'll get a new cancer.
I know that I have cancer, but I don't look forward to an additional cancer.
Studies have linked CT scans to higher risks of cancer. A study in the Lancet Medical Journal last June suggests kids who receive 2 to 3 head CT scans before the age of 15 might have triple the risk of brain tumors. Cross says he was never told about a cumulative risk from CT scan radiation.
I'm the patient, and I go there for help, and I go there for to get well. I don't go there to get more problems.
I think 17's a lot.
We showed some of Cross's CT scan results to Dr. Rebecca Smith-Beinman, a specialist on radiology and biomedical imaging at UC San Francisco. She's never treated Cross, but has been a critic of the overuse of CT scans.
Some of them looked reasonable, and some of them didn't look like it was going to help very much.
Smith-Beinman says multiple CT scans are common and sometimes needed, but that doctors and patients need to know the risks before any test is done.
The risk for any one test is relatively low, so not a big risk, but the risks are additive. So if you've had 17 CT scans, the risk is getting up there to a place where it's a real possibility that that patient could develop cancer directly in response to the DNA changes from that CT scan.
A study published in the New England Journal of Medicine in 2007 estimated CT scans accounted for up to 2% of all cancers in the United States. Smith-Beinman says that number could now be 5%.
Somehow we have blown out of proportion and out of context the radiation risk from CT scans.
Dr. Michael Brant-Zawatsky is a radiologist and executive director of neurosciences at Hoag Memorial Hospital in Newport Beach. He points out that the cancer rate is down slightly and says there is no evidence CT scan radiation has a cumulative effect. The radiation from multiple CTs shouldn't be added up to one big dose. Each event is separate, done at different times, allowing the body to heal between tests. He uses a sunburn analogy.
If you stood there for an hour, one dose, you'd get a red blistered skin. Whereas if every week or so you go out for 5 minutes, 12 weeks, an hour's worth of exposure, nothing happens.
Brant-Zawatsky adds even if there is a small cancer risk with CT scans, the benefit outweighs the risk.
The need to destroy the cancer is much greater than the slight concern from a CT scan being used to monitor whether or not the treatment's being effective.
That's my dilemma. I don't know how to weigh saving somebody's life and then potentially them dying later.
Brian Cross has one more problem. In a letter last month, his oncologist told him to find someone else, writing, "There had been a breakdown in our therapeutic relationship. I recommended that you find another oncologist. You will need to do so within 30 days. Leaving Cross without a physician and with the worry more cancer is in his future.
I can't help but think of how many CT scans I've had, and it scares me, but I mean, all you can do is have hope. that's the last thing to go.
Both doctors we spoke with said CT scans save lives but are overused and the radiation dose needs to be low. A patient can always ask if other tests that don't use radiation, such as an MRI or an ultrasound, will be a good alternative. Dan, Carolyn.
All right, Dan, thank you.